When you first come to the hospital, a number of appointments will be made for you to help diagnose what is wrong.
You may meet a doctor who may want to ask you some questions, possibly have a feel of your tummy. The other thing they may want to do is to examine your back passage, so pass a finger into your back passage to make sure that there's nothing there that should not be there. You may also have some blood tests. They would also probably want to send you for a camera test. This is when a camera is passed into the back passage so that it can go up round the bowel and look for any signs of cancer.
As soon as he entered the camera into my rectum, that was where the tumour was.
I had the colonoscopy done on a Saturday. On the Monday, I had a phone call from my cancer nurse who said, we've taken biopsies which haven't come through yet, but we need to book you in for a CT scan and an MRI scan.
Things started moving really quickly. I had a CT scan, a colonoscopy and an MRI scan booked. So they all happened within the space of 10 days. And that was a really worrying time for me and my family.
It can be quite confusing understanding what these different tests are. If you do feel uncertain or unsure of what's happening at any stage, please do ask your clinical team to explain further.
I spoke to the nurse, who was really helpful. She went through the whole process with me. This is what you do. You'll have a CT, MRI, we'll get your biopsies, and then the consultant sit down, have a meeting, and then we go through what treatment you're going to have.
The whole point of this stage was to confirm whether whatever was inside me was cancerous or not. The doctor that did the colonoscopy and a nurse took me to the family waiting room and said to me that this looks like cancer. You have to allow time to let it sink in, really.
For information, support, or just someone to talk to, call 0808 808 0000 or visit macmillan.org.uk.